big warm welcome to all of you. Thank you for joining us today. I hope September is going on well for everyone. Everyone's well. So great to see you all here. We are here to discuss a very pertinent and important topic on how to prevent cancer through early detection. And we are very happy to have NURA again to talk to us, to kind of enlighten us on this very important topic. I think the big C is a word that all of us kind of detest and do not want to hear in our lives. But so is there a way to really keep it at bay and keep it away from us? So I think that's the topic that we are discussing today. So I'll hand over to Dr. Tausif in a while, but just let me quickly introduce myself. I am Nidhi, and I am representing Silver Talkies, the organizers for today's talk. Silver Talkies is an organization which has been working for older adults, with older adults since 2014. And our motto and our vision and mission, everything centers around how to promote healthy aging, how to keep seniors active, help them lead a healthy and active lifestyle, so that, again, because since we are on the topic of preventive healthcare, it's our sincere belief that staying active is the most promising and economical form of preventive healthcare, right? So if you're happy, you're engaged, and you're active, you're more likely to be healthier, right? So that's what we do at Silver Talkies. We have a very vibrant community of senior people. When I say senior, I mean by people above the age of 55, and all these people, I think they are brought together by a desire to age gracefully and age, well, and that's why they are all part of a community like ours, where they interact with each other. They have these social connections which are happy and active and healthy, and we do a lot of engaging activities. Have many engagement programs ranging from awareness sessions like today, to doing skill building workshops, hobby workshops, learning new skills, starting with a language class. We are starting a spoken Kannada class next week. We have a theater workshop running right now. And we do monthly, every month we have classes on yoga, bhajan, fitness, and many other modules that we keep adding up just to meet different interests. So if that is something which is your desire in life as well, that you would like to stay active, I invite you to join us. You can become a member from anywhere in the country and even abroad. We do have members joining us from Dubai and other locations as well. And we plan to continue our activities in a virtual format, and have these member meetups even at physical locations once the COVID situation dissipates. So we would have a combination of both physical and virtual meetups going forward as well. So a very warm welcome to you. And if you want information around any of these topics that we talk about today or in other sessions, you can visit our magazine. Our website has a magazine section, and our website is silvertalkies.com, where you can actually read up articles which have a lot of inputs from experts like Dr. Tausif and others. And you would also find stories of many inspiring seniors like yourself, who have been, who are an inspiration for all of us. So do look us up, and we will also share the details here in the chat box shortly. Now, I would like to invite Dr. Tausif, who is the guest speaker for today. He's representing NURA. NURA is a collaboration between Fujifilms and Dr. Kuti Healthcare, and it's basically the idea behind NURA has been how to combine technology and bring it to health screening, and how to really enable a healthy lifestyle. So they run a center here in Indiranagar, Bangalore, which is a beautiful place, a very nicely done up place, where you can undergo a 2-hour kind of screening program, where you would be checked for cancer and other lifestyle diseases, so that you can actually catch anything which is coming up in your system fairly early on, and take ready action on it, right? So please, if you're in Bangalore, do visit them. And Dr. Tausif is the general manager and the medical director of NURA. He was formerly with Premier Hospital Hyderabad, where he was the medical director and consultant emergency physician, and he also headed academics for the hospital. And prior to that, he's also had experience in Kochi, again in emergency medicine. So in fact, just before all of you joined, I was asking him, how does it feel to leave emergency medicine and be here? So he was telling me how he misses the whole being in touch and being active and taking care of patients very actively and in a time sensitive way. So he is very passionate about healthcare. And when he's not focusing on healthcare, he's actually also been a radio jockey for 10 years. And he was hosting a primetime show with two popular radio stations in Chennai, Fever 91.9 FM and Chennai Live 104.8 FM. So that's Dr. Tausif for you.
Nidhi-san, it's a pleasure as always. I love the way that you interact with everybody who comes here, and it almost feels like I'm talking to somebody's family, and it's fantastic. Whatever work you're doing is great, and we are happy to be associated with you. Okay, without further ado, let me get into the topic, and I'm sure we'll have a lot more time to take questions later. Okay, so this is my screen. I hope all of you are able to see it. Right. Okay, so what we wanted to talk about today was cancer prevention through early detection. Now, it's something that we don't focus on in India. So we thought, let's discuss this. And my biggest challenge today has been to keep it as simple, as straightforward, and as easy for you. And at the end of it all, any questions that I haven't answered in the slides, please feel free to ask them. So let's first things first, we have to get to know about cancer. So let's find out what is cancer. Now, when I say cancer, what cancer really is uncontrolled growth and division of cells caused by certain changes in the body that happen. So what causes these changes? The first, some of them can grow rapidly because of these changes, and some of them grow slowly. That's how cancer can be. Some are visible, like we have tumors that we know, we see, doctors tell us about it, we do a scan and we can find them. And some are not visible, like we say in the movies, blood cancers or leukemia. They're not visible to the eye, but we know when we do tests that they are there. So that's how it is. And the primary problem here is, unlike all our other cells, which after a certain point of time, they die, cancer cells refuse to die. They refuse to die on their own, what we call as apoptosis in the medical terminology. Cancer cells don't do that, and that's why they are. How do they grow? They grow slowly. They initially become a genetically altered cell, as you can see. Then they go on into hyperplasia. Hyperplasia basically means growing beyond what they normally should grow. Dysplasia means abnormal growth. So in hyperplasia, they have the same shape of their original cell, but they just grow more in number. But in dysplasia, they change their shape, and then they become cancer. Cancer in situ means it's not visible to the naked eye, but it's there inside the cells. But then it becomes bigger, it can be benign or malignant cancer. Of course, this is a famous personality, Black Panther. If you are a fan of Marvel series, sadly we lost him, a very, very fantastic actor, had colorectal cancer and he passed away. Right, moving on. How does this harm us? How does this uncontrolled growth harm us? One, it uses up nutrients and oxygen meant for other cells. So other cells cannot grow, so they cannot function. That's important. As they grow, they become big, they start compressing, they start destroying other cells that are there. So again, there is dysfunction, whichever organ or whichever part of the body that they are growing. They also impair the immune system. They destroy the immune system so that the person becomes prone for infections. And they're not able to fight back against this uncontrolled growth, because our immune system is also a protector. They're also soldiers who take care of such uncontrolled things that are happening in the body. Then once they are done doing it locally, they spread to other parts of the body. And this spread can happen through lymph, as we call it, or bloodstream, or direct seeding. Most commonly, it's the lymph. What is lymph? Whatever fluid is collected in your tissues at the end of the day, they tend to bring it back into the circulation. So that's the most common route of transfer of cancers. So this is how they harm us. So let's move on. What causes cancer? Now we know the problem, but how does cancer occur? A lot of people really want to know the answer to this question. So there are some common culprits that you cannot change. These things are not modifiable. First and foremost is age. 87% of cancer is seen in people above 50 years of age. That's how cancer occurs, unfortunately. So that's how it is. Then there's genetic risk. Now, this genetic risk can or cannot be hereditary or rather transmitted in families. It may or may not be familial. So it may be that somebody is getting it from their parent or not. So it's not necessary that it should always be like that, but there is some problem with the genes. Now, what are these problems that can be there? First, the genetic code is wrong. Now, this genetic code, when it's wrong, it forgets to tell the cell when to die. So then the cell continues to grow unlimited. It does not stop growing. It can have faulty protein production. That means it gives wrong instructions to the cell. It tells the cell to do something else when it should be doing something right. So then it starts doing something wrong, right? Eating up other cells, starts killing other cells. So that's what it does. And there's also inability to repair damage. All our human body cells, when we go through wear and tear, we have our own system of repairing that damage. All the dead cells are eaten up and the new cells are growing there, and whatever damage is there to the cell wall, it is corrected. But if there's a genetic malformation, then it can impair that ability. And of course, there are triggers, especially sun and smoking. Mostly in people, in Caucasian people, when they have the white people, when they have exposure to sun, because of the lack of melanin, they have a higher risk of cancer. But smoking is a cancer risk for everybody across the world, not just for people with that particular skin type. So these are some of the things that you cannot change. But fortunately, there are some things that we can change. First and foremost is cigarette smoking or use of tobacco in any form. In any form, tobacco is cancerous, and that makes it one of the common causes of cancer in India. And we will look at that in just a bit. Moving on, alcohol abuse. So if we don't use alcohol wisely, what it will do is it will really, really harm the liver. It will harm the intestines. And this continuous damage will force the cell to transform, to protect itself. And this transformation, more often than not, can lead to cancer. So abuse of alcohol, again, is a big problem. Obesity and poor nutrition. So both of them. So it's not just about being overweight, but also not eating well enough can also cause cancer. Now, if anybody eats excess fatty food, then it can lead to, say, colon cancer, prostate cancer. If they can, they're not having a proper nutrition, then that starvation again will cause cells to become abnormal, react, and then get into cancer. So both ways, your diet should be carefully maintained. And of course, physical inactivity. The more active we are, both physically and mentally, the better our organs remain. So if we don't indulge in activity, then we are at risk of cancer. So these are some of the things that we can change. Ultimately, it always boils down to all of this, with whatever chronic lifestyle diseases that we have. Okay, let's move on. What are the types of cancers that we know? So the cancers, as per doctors, are classified based on a few things. One, where is it located in the body? It can be brain, lung, breast, stomach, prostate, cervical cancer, uterine cancer, ovarian cancer. So based on where it is located in the body, we call it that particular cancer. Then it can be depending on what kind of tissues it's arising from. For instance, if it comes from the muscles, we call it sarcoma. If it comes from the bones, we call it osteoma. If it's from the glands, we'll say adenocarcinoma, and so on. So we classify it that way. We also decide based on whether it's rapidly growing and spreading or it's just localized to one area. So it can be malignant or benign. So if it's benign, we're very happy because it's not spreading, it's not causing damage to anyone around it, and then we can be removed and cured easily. But if it's malignant, then the earlier we treat it, the better it is. Otherwise, it will cause widespread damage, not only in the local area, but can also spread to distant areas of the body. So that's what we call as metastasis. So when it starts spreading beyond where it started, we call it metastasis. And generally, that means that person is in stage 3 or stage 4 cancer, which is not good. So stage 1 is when it's just within the cell. Stage 2 is when it is growing in the surrounding area. Stage 3 and stage 4 and then starts spreading across the rest of the body or beyond where it started growing. So some of the common types of cancer, the most common cancer in the world is breast cancer. Okay, by far among men and women, the most common cancer in the world is breast cancer, and 2% of this occurs in men. 98% is in women, but men are also prone for breast cancer. That's why it is such a big disease. Okay, we also have lung cancer that comes a close second, and then there's prostate cancer as well. So these are common cancers. We also have colorectal cancer, again, very, very common cancer. And then the reproductive organs, ovarian, cervical, uterine cancer, mainly because of change in hormones that happen after a certain age in women, after menopause, also if they're taking oral contraceptive pills, and so on. So all of this can then lead to these kinds of cancer. And in India, particularly because of the use of tobacco, oral head and neck cancer are very, very, very common in India. So these are some of the common types of cancers that we get to see. But yes, cancer can affect any part of the body, and there are many, many different types of cancers. At least 60 that we all encounter routinely. Okay, let's move on. So what? So what if there's so many types of cancer? Well, the idea is cancers kill. That is what we know. Of course, this is about cardiovascular disease being the most common cause of death across the world. But at number 2 is cancer. Number 2 is always cancer. So cancer, even in numbers, is hiding just behind, and sometimes it's not visible to us, right? It just silently attacks us, and it is like across the world, it is like that. So after heart attacks, cancer is the most leading cause of death. You take any country, you take US, yes, again, cancers are right there. It's number 2 behind heart disease. In Japan, it's number 1. It's number 1. Heart disease, they've managed to control by early screening. They've brought down that risk. Cancer, especially lung cancer, they're still trying to figure it out and get it under control. Okay, and India, yes, cancers are there. So we see cardiovascular disease is number 1, but cancers are not far behind. They are at number 3. So you have respiratory illnesses, and then you have cancers as well. So there are cancers in India as well, and they are growing and slowly becoming, closer and closer to the number 1 killer in India. So that's important for us. So let's look at a little bit more about this problem in India. Something that we don't, really focus on. So here it is. So top 10 cancers in men in India, like I said, lip, oral cavity, secondary to tobacco use. This is the number 1 cancer in India. Okay. And then a lot of people die from it. Almost more than 50% are dying because of this cancer. Second is lung cancer. Unfortunately, if you see the lighter green line, it's telling the mortality from these cancers. Lung cancer has a very, very, very high mortality, simply because it is detected late. We use an X-ray to diagnose, and an X-ray is not always the best modality. Ideally would be a CT scan, right? So lung cancers. Then we have stomach cancers, again, notoriously difficult to treat. Colorectal cancers, and the intestines come there, and then throat cancers. So this is in men. When we move on to women, like I said, breast cancer is the most common in women, and then the cervix and the uterus, so reproductive organs, and then the ovary. So these 3 are most common, and these 3 are something that we should always screen women for, especially after menopause or if they are on oral contraceptive pills. And then, of course, again, tobacco use is common, smoking is common, so lip, and then the routine, colorectal, lung cancer, and so on. Everything comes on that paradigm. Now, the most important thing here, the data that we've learned from Japan, is that if we treat cancer early, or if we detect it and treat it early, the survival rate is very, very, very high. You're looking at a 90%, near 90% survival rate for most cancers, except maybe lung and esophageal cancer, which is a little lower, but otherwise nearly 90% survival rate if it is detected early. So that is primarily what we should do with cancer, rather than just wait for it to strike and then know about it once it's too late. So that's important. Again, in the UK, again, 5-year survival rates are very, very high in the UK, simply because it is detected early and treated early, and it is part of routine screening. Unlike our country, in our country, we don't focus on cancer when we do routine screening, and we don't even talk about it. We don't like to talk about cancer. We just, from our movies, cancer is supposed to be an end-all disease. It is not. If detected early, it can be treated very well. And this is India. This is where we stand when compared to the rest of the world. When we look at breast and cervical cancer, we are way, way down. Where we have highest of 90%, we are at 66, 67%, cervical cancer at 60%. So we are quite down the ladder, not just in breast and cervical cancer, but also in colon and rectal cancer. It gets worse, 53 and 30% survival. And then when we look at lung and stomach cancers and leukemia, lung and stomach cancer is only 4% survival, 10% survival. Leukemia is slightly better, thanks to some good drugs that are still available in our country. But lung and stomach cancer is very, very, very poor prognosis, in India. It's very difficult. But Japan, as you can see, is right there on the top. Okay. Now, this is a direct comparison between India versus Japan. You may notice in lung cancer, the incidence seems a little higher in Japan, but their survival is also higher. You see the red arrow mark there. Although the incidence is high, the survival is much higher as well in stomach cancer and lung cancer and oral cavity cancer. In India, it's almost like an end-all disease. Once they're diagnosed, it ends. So that's probably because it's diagnosed very, very late. So that's what happens. Again, when we look at women, Again, breast, uterus, and ovary. Again, although the incidence is higher in Japan, the survival is also much higher. The mortality is lesser as compared to India. In India, more people die once they're diagnosed from breast cancer or uterine cancer or ovarian cancer. But in Japan, more people survive. Again, this is because of their mandatory yearly screening that everyone has to do. They do annual screening with special focus on cancer. So that is why there is a bigger difference between India and Japan. Okay, so then again, when we look at more data that's available from our own country, we find that in cancer detection in early stage is only a very, very small proportion of people in India, and treatable cancers are not treated because they are detected late. So in stage 1, when you take Mumbai, Trivandrum, Chennai, and Lucknow, in breast cancer, stage 1 is only less than 10% people are detected in stage 1. But in stage 2 and 3, then nearly 70% of people are detected there. Stage 4, of course, by then everything is obvious. There are symptoms, people know what's happening. But stage 2 and 3 is where 70% of our detection happens. And that could account for the high mortality that we have. Again, the same story unfolds with colon cancer as well. In stage 1, we have very, very few people who are detected. But stage 2 and 3, and then sometimes in colon cancer, even stage 4 is where we finally detect it, which is very sad. And that at that point, it almost is not treatable. So that is the big problem that we have in India. Now, once detected with cancer, can anyone survive? So let's look at what are the current treatment options for cancer so that you are more aware and can actually help people who want to come to you for advice to tell what therapies are available for cancer. We know about surgery, yes? So now this all depends on the type of cancer, the stage of diagnosis, and the person's overall health. So where is the cancer? What is the kind of cancer that we already discussed? At what stage in the diagnosis is it? It's stage 1, 2, 3, or 4? And is the person healthy enough to undergo the procedure or not? Most importantly, surgery. The surgery is traditional. We try to remove as much as we can, and it includes removal of the lymph nodes. Like I said, the most common route of transfer of cancer is the lymph. So we try to remove the nearby lymph nodes and some surrounding areas. A lot of my people who consult with me, they ask me, they want to remove the lymph node. Should I go for it or not? And I say yes, because that's one place that we cannot know until we remove it, whether the cancer cells have already moved there or not. So that's what we do in surgery. And we try to see as much or as little can we get away with while treating that. But then you also know about chemotherapy. Chemotherapy, we use medicines to kill rapidly dividing cells, right? They can also be used to decrease the tumor size. The problem here is the side effects. Now, when we say rapidly dividing cells, some of the normally rapidly dividing cells in our body are hair, skin, our GI tract. All of these are rapidly dividing as well. So that's why there is hair loss. There's also severe nausea and vomiting and diarrhea. And there's also the skin changes that occur with anyone who is undergoing chemotherapy. So that is the reason why they have that. But as we are improving in today's day and age, chemotherapy drugs are getting better and better, and the side effects are coming down. So there's no need to be so afraid of chemotherapy anymore. Let's move on and look at some other options that we know. One is hormone therapy. Now, this changes how the hormones work in our body, especially in cancers that are dependent on hormones like prostate and breast cancer and ovarian cancer. These are all dependent on hormones. So we can use hormone therapy to try to change the way these hormones are pushing these cancers to grow. So we inhibit them using hormone therapy. So that is one way of doing it. We also have immunotherapy. Now, this is a newer version of treatment of cancer. We use medicines to boost our own immunity to kill the cancer cells. It's a very nice therapy. Unfortunately, we have to first find out if they will respond to these drugs. But if they do, it has good prognosis. We can really kill the cancer cells by using our own soldiers to kill these badly performing cells. We can use it for any part of the body like lung, brain, breast, cervical, head and neck cancers, but only if we know that they will respond to these medicines that can boost our immunity. We also have radiation therapy. We use high-dose radiation to kill cancer cells. It can also be used to reduce the size of the tumor, can be used in any part of the body. And with precision radiotherapy, this is becoming more and more tolerable with less adverse effects. People are able to handle this much better. We also have stem cell transplant, where we remove the RBCs and WBCs which have been affected by the chemotherapy. We strengthen them and put them back, especially for blood-related cancers like leukemia and lymphoma. So stem cell transplant over the last 10, 15 years has gained a lot of ground, and a lot of people opt for this as a first choice treatment. So that's also there. We also have some newer options for treating cancer, which is called precision medicine. So we do a host of genetic tests to determine what is the best approach to treat a cancer. Unfortunately, that's not at this point available, or the complete panel is not available in India. Maybe only in Tata Memorial Hospital and a few other centers in India might have this genetic testing. But if you go to countries like Japan or Korea, where they have an advanced healthcare system, they can do much more extensive testing. I mean, what would cost you about 2 lakhs here may cost you about 5 lakhs. But the number of genes that they will test will be in about multiples of thousands, 40 to 50,000, whereas in India, they may test for about 5,000 genes or so. So yes, other countries are better at it than we are, but this is the new way forward that we're doing, and we're still studying the effectiveness of that. And then we have targeted therapies, which are new again, monoclonal antibodies. They go to cancer cells, they change them from within and how they act, and they inhibit them from growing. And they also boost the immune system to fight these cancer cells. So these are exciting new therapies that are there in cancer. So the bottom line that I want to make with these slides is the fact that cancer is treatable. Cancer is immensely treatable, and we can treat it. If provided we detect it early, we always have the upper hand. We detect it late, we can try some of these options and see if we can still win the battle. That's how cancer therapy is. So let's come to an important question. How do I survive cancer? That's very, very important. Here we always say silence is not golden. First and foremost, eat healthy, get appropriate rest. Make sure your body takes in a very balanced diet. More, how do you always say? Anything excess is harmful to the body. So everything in moderation is the way to go. Enough rest, appropriate rest that you need. Make physical activity a part of your lifestyle, of course. Avoid smoking, tobacco, other known irritants. There are many other known irritants, chemical irritants that we are aware of, dyes, chemicals that are used for spraying, pesticides. All of these are harmful. Over time, they all accumulate and cause us a problem, especially radiation. Again, radiation is a big problem that we have. So we have to be careful about the amount of radiation that we are exposed to. That's why at NURA, we have this really low dose radiation. But anyway, that's what we're working on for safety. But again, that's something that we must know. And yes, limit alcohol as much as possible, keep it under control. But most importantly, be aware. Knowing beforehand is the key to survival. So like I said, if we detect it in stage 1, everyone, about 90% are treatable. But beyond that, then it becomes a tougher battle to fight. How can I be aware? Can I recognize cancer early? Well, that's what NURA focuses on. So I'm going to quickly, in the next few slides, show you about what we do at NURA, and I'll try and keep it as quick as possible. This is NURA. We are placed in Bangalore on Indiranagar 100 feet road, and we bring the Japanese way of advanced full body health screening to India. It's the first of its kind center in India, and even in Japan, they don't use CT scan to screen. They use only X-rays to screen for lung cancer. So how do we screen for cancer? So for women, we do the following. We do mammography for breast cancer. We do a colposcopy for cervical cancer, again, two of the most common cancers in women. We also do CT scan for lung cancer. And this is an ultra low dose CT scan, which is equivalent to just one X-ray. Routine CT scan is equivalent to 80 to 100 X-ray. This is equivalent to 1 or 2 X-rays. That's the amount of radiation that you get. Oral examination for oral cancer. We have a dentist who looks at it as well. And then we have a FIT kit, fecal immunochemical kit, which is for checking for colon cancer. We'll do a stool test that way. For men, again, we do the same things. We do a lung cancer screen with CT scan, oral cancer, FIT kit, but additionally, we also do prostate cancer check, which is the third most common cancer in men. So prostate specific antigen is how we do it. People that we have been able to help so far, let me quickly show you a few pictures. One, a lung CT. This is how we do our lung CT. And as you can see, what you are not able to see on the naked eye, the artificial intelligence can pick up. This little nodule that's there in the lung, we keep a target of about 6 millimeters. If it's beyond that, then we think it needs observation. If it's beyond 8, we think we need to send them to a doctor. Remember, I'm talking about 8 millimeters, which is less than a centimeter, but the artificial intelligence can pick that up. Yeah, there you go. It's highlighted there in purple and showing up in that area. I have another patient, another guest also, another early diagnosis that we had. Again, this is the nodule that we found for that person, and it was higher up in the upper area, between the middle and the upper lobe. So again, this would be a good candidate to be sent for further examination to the doctor, or at least observation, so that they can watch and see how it grows or doesn't grow or comes down. So that's important. Mammogram, yes, this is how we check for breast cancer, and we have this, how do you say, unconventional and the new software paddle, which reduces the pain in mammography. Otherwise, generally, because of the compression, there is pain here. We have it nicely contoured, so it doesn't cause that much pain. And these are the images. Now, these are samples that were tested before we put it into practice, where in the naked eye, this nodule was missed, but the AI was able to pick it up later. When we showed 2011 images, again the AI was picking it up, but in 2013 was when the naked eye was able to pick it up. And this is one of our own patients who had a nodule. We were able to, and this is how our images come. We were able to tell that guest, okay, please go and see the doctor. They went and saw the doctor, got a scan done, and they're very, very thankful to us that they were able to pick it up early. So that's how we do our mammography. Let's move on to colposcopy. This is the room where we do cervical screening. We have a camera, it takes photos, and these are how the cervical screening photos come up. So these are the actual images that get taken care. The artificial intelligence reads it, picks up if there is any problem there. This is one of our guests who had a 99.7% probability of having cervical cancer, or at least needed further testing. And we thankfully and successfully referred them to a good gynecologist who took care of that. So that's in colposcopy. Prostate-specific antigen is a very simple blood test. We have a worldwide accepted blood value that we follow. Anyone who's on the higher side, like this person, this gentleman who's come, we tell them, okay, go and get a biopsy and then check if there's anything that needs to be worried about, or follow up with your urologist. So we were able to send this gentleman. This is how our report comes up at NURA. Fit kit for colorectal cancer, very, very simple and easy test to do. It's a stool sample. You can just take it on tissue paper and then test it and put it back in. Or we check it for you. If there is anything, we can find it as a D, and we tell people to follow up with their gastroenterologist. We also have a dentist who looks at the oral screen. We have a blue light and a white light that we use to find out any suspicious lesions. So all of these checks are done. And again, this was one gentleman who had a suspicious lesion that was picked up both on the green light by the artificial intelligence and confirmed by our dentist as well. So there was a serious score level of 4 for this person on the left side, and then we referred them to the right doctor for that. So that's the D that has come. Okay. Right. So these are all the cancers that we screen for at NURA. I mean, I know I'm asking for questions, but Nidhi-san will tell me, okay, let's do questions at the end. So I'm going to put up a few questions of my own, which for lack of time, I thought it might be easy to discuss rather than answer it on my slides. First is, how often should I get myself screened? Okay, we can discuss it going forward. What signs and symptoms should I look out for when I think about cancer? When do I need a PET scan? What is the risk of developing cancer again once I have already been treated and cleared from cancer? And cancer and COVID-19. So these are some questions which are there. If you want to ask me, I'm more than happy to answer, and any other questions that are there. Let me quickly summarize. Cancer is caused by cells that forget to die for various reasons. They just forget to die. So then they start just growing continuously. Genetic factors and lifestyle choices together contribute to cancer. So it's not just genetic. There are some lifestyle changes that you can make which can keep you healthy and safe from cancer. Breast cancer is the most common cancer, but lung cancer is the most deadly one, and it kills much more than breast cancer does. Early detection is key to survival. Numerous studies have showed this. A lot of us don't look for it because we don't have symptoms, and by the time we have symptoms, it's really, really late. And then it's a tough battle to fight. So early detection is always key to survival when it comes to cancer. And cancer treatment and survival rates are improving day by day. So that's the good news. So it's not something to be scared of and be afraid of. You have to deal with it head on, and then you can be the winner every single time. So don't be afraid of cancer anymore. We're always improving it and doing well. And this is Michael Douglas. I don't know how many of you like Michael Douglas. Okay, but yeah, he said, cancer didn't bring me to my knees, but it brought me to my feet. And he's a survivor. He's a famous survivor, a popular actor as well. This is Hank Pym as Ant-Man's creator. Okay, at Fujifilm, it's always about never stop. And at NURA, we would ask you to choose health. Thank you.
Thank you so much, Tausif-san. I think that was really wonderful. I would suggest, I think we can go through that set of FAQs that you had put up there, because it would actually answer a lot of things.
And do you want me to put them back up?
Yeah, I think if you remember them,
Okay,
you can
okay.
just take them up one by one.
I'll put them up. It's better.
Okay.
People can relate better. Right. Okay. Yes, there you go. So how often should I get myself screened for cancer? Well, it depends, right? Generally, active screening starts after the age of 30. Yes, not necessarily for cancer, but general screening. For somebody who is healthy, you can do it once every 2 years. Somebody who has no lesions, no problem, nothing, once in 2 years, go get yourself checked. Because why after 30? Because generally at 30, we feel we are in the peak of health, yes? But the body's biological clock goes up and goes down. So it's a crescendo, decrescendo, okay? So we are all going up and being very healthy and strong till about 30. Our muscles are developing, we are at the peak of our health. After 30, our muscles start slowly getting wasted. If we don't have physical activity, our bones become, weakened, and we start, degenerating or going through wear and tear. Unless we stay active, do exercise, then we are healthy for 50, 60, 80. Some people are even healthy for 100 years. But that's very, very important. So that's the time when you want to check yourself and see, am I going in the right direction? But definitely after the age of 40, you must get yourself screened at least once a year to find out what's happening with yourself. Women in the reproductive age, beyond the age of 35, at least once in 2 years, they must get a mammogram done for breast cancer, which is the most common one. But once they are beyond the age of 40 or 45, once a year is mandatory. And if there is anything that seems to be suspicious, once in 6 months, a mammogram will be recommended or a screening will be done. So that's how screening must be done. How often should you screen yourself? It depends on the age and what we see. If there is nothing, if it's beyond 40, do it once a year. Beyond 30, do it once in 2 years. If there is a lesion, try to screen it every 6 months to see what's happening with it and plan for anything that may be needed. What signs and symptoms should I look out for? The reason I didn't cover this in the slides is because it depends on the organ that is affected. So some generic signs and symptoms that you can be concerned about. One is weight loss. So sudden, unexplained weight loss. At the back of our mind, it's not always the first diagnosis, because in India, the first diagnosis is always TB. We're always thinking about tuberculosis as a doctor. But yes, next best would be cancer. So any sudden, unexplained weight loss, we must think about cancer. Then there is a wound that refuses to heal. If there is a wound that is refusing to heal, it's either diabetes, or we have another disease called SLE in women, but it could also be cancer, right? So you're looking at a wound that's refusing to heal. Also, a pus discharge or a bloody discharge that's continuously happening from a wound. Then again, you must think, is this cancer? Is this something that I'm dealing with? Of course, there's loss of appetite as well. So these are some general symptoms that we look at when we see people coming in with symptomatic cancer. But remember, by that stage, it's already, stage 2. It's already obvious to you. It's not stage 1 anymore. So that's something that we always have to be forewarned about. Plus, depending on whichever organ it is affecting, for instance, stomach cancer, a lot of vomiting will be more. Breast cancer, there'll be pain and swelling that's there. Colorectal cancer, there may be bloody stools that's there. So, and lung cancer, there'll be cough, hemoptysis or blood in the sputum. These things may be there. So depending on the organ that is affected, the symptoms can vary. But the smart thing to do is find it before the symptoms start. Because by the time the symptoms start, we are in stage 2, sometimes sadly in stage 3 already. Okay, I had somebody I know who was just diagnosed with stage 4 colon cancer, and they had no clue completely about it before that. And they're only about 56 years old, sadly. Okay, so it's always better to be smart and diagnose it early. When do I need a PET scan? Well, a PET scan is only recommended after a diagnosis of cancer is already made, right? We see something suspicious on an original, say, a CT scan or an ultrasound, and we see something that looks like cancer. Only then we do a PET scan, and that too to find out about the spread. Is there spread to any other part of the body? So we want to know if it's stage 3 or stage 4, so we do a PET scan then. Not everybody needs a PET scan, and definitely not for screening. It is only when we suspect cancer in somebody, and then we do a PET scan to see if it has spread to other parts of the body. So that's what's important about the PET scan. It's not a routine screening tool that we use. What is the risk of developing cancer again once it's cleared? It depends on the cancer. Most cancers, once the doctor tells you it's completely cleared, the chances of relapse are generally about 5 to 10%. Now, why is this risk there? Because the cells sometimes are not visible to our naked eye when we're doing the surgery or doing the radiotherapy or chemotherapy. So either that, or it's passed on and moved on to another area already, like the lymph node or maybe an adjacent organ. So that will then start growing again. So that's the only reason that it comes back. If it was visible to the naked eye, like a pus, like an abscess, then it's easy to remove everything. But this looks like just the other cell. So once it's in situ, which I told you, within the cell there is change, but outside we don't know, it's difficult to see. So sometimes they can come back. Cancer and COVID-19. This is very, very interesting. The first set of people that we were worried about when we said COVID-19 was people who are immunocompromised. But thankfully, they have done well in COVID-19 because their immune system is not able to react the way the immune system of normal people react, right? So cancer people are able to handle COVID-19 very well and have not seen them really develop any serious complications because of COVID-19. So people with cancer have reasonably been safe with COVID-19, but because of their low immune system, they are higher risk for other infections, secondary infections, but not so much for COVID-19. They may get it, but they don't have such severe symptoms as far as current data is there. Mortality rate in cancer patients is only about 0.7% in COVID-19. Okay, so that answers the questions that I had. If anybody wants to ask more than happy to answer.
Wonderful. Thank you. Before I get into the remaining questions that I have on the chat box, I just wanted to share my personal experience. I have been a candidate for NURA screening. I got it done early this year. And so when I got the screening done, my screening showed that I needed to, there were some spots which needed to be studied further for my lung and breast cancer and cervical cancer as well. And I did visit an oncologist to check on all that. But luckily for me, everything's fine. But I have been advised to kind of do these checkups every year just to be sure. So yeah, so I think, having experienced it, as Dr. Tausif was saying, I'm a strong believer now that, it's good to be safe rather than, put it out to later times and say, okay, everything's all right by me, right? I wouldn't have known that these spots existed till I done the screening. So yeah, so just wanted to share my personal experience there.
Absolutely. Like I said, it's the smart thing to do. I mean, there's no stigma anymore. There's no fear. We are brave. We are bold. It's a bold new world. Find out and beat it. Don't be afraid of it. That's what I would tell anyone. And you asked me if I, emergency medicine versus preventive medicine. I feel I have more power now. I can do more. So that's what I'm trying to do. Yeah.
Lovely. Yeah, and also, you were talking about the mammography and how the machine's really less painful, and it indeed is. This was my first mammogram that I ever got done. I'm 40 plus. And it was a breeze, it really, all my fear that I had before walking in, I remember telling Dr. Latika that, I really don't know what to expect, but yeah, I was put at ease. It was really a wonderful experience.
Thank you, Nidhi-san. I'm glad. Hopefully we can get the message across to everyone else as well. Thank you so much.
So I have a few questions here. The first question that I'll take up from Dr. Padma, she wants to know, how do you boost immune system for cancer therapy?
Oh, so basically the immunotherapy and also the monoclonal antibodies, there are two things that we can use to boost the immune system. The monoclonal antibodies are much more simpler to explain. Basically, we look at targeted antibodies against these cancer cells. It goes there and prevents the cancer cell from growing. At the same time, it is boosting your immune system because it is also an antibody. Our immune system handles all of this by producing antibodies. So we are already giving antibodies from outside. Immune therapy now needs to look for certain switches that are there in the body. So they will then go and see, they will do testing and see if there are any immune receptors which this particular cancer will respond to, or where we can trigger off the body to produce antibodies against the cancer cell. So this is what has to be done. It's unfortunately, we're not able to treat many cancers because of it, but the ones that we're able to treat because of immunotherapy, there has been fantastic response. And the adverse effects are very, very less. So immunotherapy is great, but the options for treating many cancers is still limited because we have to find a receptor which will respond to these, immune boosting drugs, as we call them.
Okay. Yashpalji wants to know, is there skin cancer? He says, I suffer from skin psoriasis. Can it lead to cancer?
No. Psoriasis generally does not lead to cancer, but yes, it is like diabetes or hypertension. It is a disease that will be there for the lifetime. It's not something that we can cure. Predominantly, in a very, very layman way to tell, in a very simplified term, psoriasis is excessive growth of the skin cells, but thankfully it is not cancer. It does not start eating the surrounding cells, unlike there are other skin cancers like basal cell carcinoma, squamous cell carcinoma, which is more common in people who have less melanin, like Caucasian people, European people, or Americans for that matter. But Indians, we have a lot of melanin. We are generally not as prone to basal cell or squamous cell carcinoma, although it can occur, but very less. Psoriasis does not lead to cancer. It's just something that we'll have to treat for a lifetime and keep expecting some flare-ups. Every time there is a trigger, especially like an allergy or something, there will be a lot of extra skin that is produced and it will flake out. Other than that, no, there is no risk of cancer conversion. So don't have to worry.
There is a related question. Mr. Anil wants to know, what are the symptoms for skin cancer?
Okay, like I already said, first, the symptom for skin cancer basically are ulcers that form on the skin and then just refuse to heal. Or there is a crack and there's constant pus discharge or bloody discharge that's coming out from there. Or if there was a mole that was there and suddenly it started growing in size and became painful. These are all symptoms of skin cancer that we can really watch for if we are worried about it. That's what we must do. So a mole, an ulcer that's refusing to heal, and persistent pus or bloody discharge happening from a crack or another ulcer that's there.
Okay. Dr. Mahesh has a question. He wants to know, what is the cost of the FIT kit for screening of colorectal cancer?
I'm not sure if it's available in the market outside. Here it comes as part of the package. It's just a small kit that's there. If you book the screening, we send it to your house. Very simple and easy test to do. I'm saying it because I've done it myself. Okay. So from experience, I know it's very, very easy to do. It's not like, oh, it's a motion test. I don't want to do it. Nothing like that. It's very, very simple, very easy to do. And it's just a small brush. You dip it, put it back. You don't even feel like, oh, there's something bad in it, because once it gets into the solution, you don't see anything. So it's clear and it's safe and it's not contaminating anything. It's not generally available in the market as far as I know. And even if it is, it's not, I don't know how to assess whether it's standard equipment. I'm not too sure. Many hospitals have not started using it yet. But in our screening, it just comes as part of the package. It's part of the whole screening package that we do for men and women.
Fawzia is joining us from Bangladesh, and her question is, are the symptoms of Bangladeshi people same as India? So are the symptoms for cancer similar irrespective of geography?
Absolutely. Like I said, it can be generic or it depends on the organ that is affected. People in different geography and different countries have their own different cancer rates. As in, like I said, in India, oral cancer is the biggest because of tobacco use. Whereas in the US, it's more of colon cancer and lung cancer. In Japan, it's more of lung cancer that's common. So geographically, the only thing that changes is which cancer is common. That's all. But symptom-wise, all cancers produce the same symptoms. Like lung cancer will always have cough and breathlessness and blood in their sputum. And colon cancer will always have some blood in the stool and difficulty in passing motion and so on, and diarrhea like that. So the symptoms are the same. Which cancer is more common depends on the country and the geography.
Okay, lovely.
Yeah.
Rajam says, one of my relatives from Chennai was diagnosed with sari cancer. Kindly explain what exactly is that?
I'm not sure. I don't think I've heard of sari cancer. Are you sure? Does it mean like the sari that they wear? Or is it some...
Rajam, do you want to unmute
acronym?
yourself and elaborate?
Yeah, that is, it was, diagnosed as sari cancer
It's called
in
sari
Chennai.
common.
It is, they say it's very common with the people where it's especially in the heat, more of hot places like Chennai, where it's continuously they are having sweating. And mainly because the pavada, what they tie it, the lenga, inside the and it keeps that, blocks the flow of circulation. And
in the
that
waist region.
waist
Okay.
region. And this
Yeah.
thing, even I got the picture of it because
No. I understand where you're getting at. Yes, now I understand. Now I
so
understand what
that
you're
it
trying
is
to
something,
say.
they said that it is in the early stage.
So sometimes as doctors, we kind of name certain things. So it's easy to identify the cause and it's easy to quickly zero in on the treatment or advise the the patient accordingly. So basically, this is consistent irritation to the skin happening in a particular area that causes the skin to react. So again, here, what is acting as an irritant is the tie and the constant irritation to the skin, but they will develop as a result of this cancer over the skin, right, over the surrounding skin. So in medical terminology, I probably just say it's a skin cancer, but the cause of it could be the constant irritation that's coming from tying the pavadi or petticoat, as we call it, there. So that might be the reason for it. Yes, but it's still skin cancer, and the doctor will have to look at it and treat it as such and decide how well they can take care of it. Right.
Okay. Thank you.
Okay.
Usha wants to know, she says, immune therapy is very expensive in India. How does one go about taking it?
Unfortunately, cancer therapy is very expensive in India. And not just in India, many parts of the world. Most places, a lot of people who cannot afford cancer therapy do a few things. First and foremost, they can enroll in a trial. So there are always cancer research trials going on with drugs. So if we enroll in a drug trial, the advantage is they get the drug free. But more often than not, it is a drug that they probably are trying for the first time in a limited group of people, maybe 500 to 600 people or 5,000 people across the world may be getting that particular drug. But it makes it cheap and free for them, number one. Number two, a lot of people do crowdfunding. Yes, they try to get people to help them, and a lot of people are willing to help, especially when it comes to cancer. Such streams exist, and they can help. And number three is to get good insurance beforehand. There is no other way. You cannot get generic cancer drugs because you're putting that person's life at risk by trusting generic drugs. We don't know if they are tested, they're regulated, are they the right kind? We don't know. Unless you know somebody in the pharma industry and they can give it to you at cost price, cancer treatment is expensive. Okay, so that is why the smart thing to do is always to know it early. The problem with cancer is, one, you're in it for at least 2 to 5 years. Okay, so there is a mental strain, a physical strain of the treatment, there is a financial strain, and also the social strain, the emotional and social strain, because cancer treatment cannot be done by just somebody going to the hospital, coming back. Yes, there always needs to be somebody accompanying, making sure they don't have any side effects if they're taking strong chemotherapy drugs, recovering from the surgery, taking care of them, and so on. And usually it's a loved one. So that is why more and more focus across the world is on cancer prevention, because it is something that's doable and it helps immensely in many, many different ways.
Right. Okay. Kanchana wants to know, she says, turmeric is considered the most natural preventive. Do you have a view on that? And are there any other natural foods or supplements that you would advise, as a preventive supplement?
Ideally, being an allopathic doctor, I should not even give my opinion on this because we talk more about medicines. But yes, turmeric is supposed to have some natural healing ability, which it has, and it should be able to treat wear and tear that's happening in your intestines. And if you have it, it should help. Yes. So it's for us as Indians to do that research and then come up with it. But as of now, as long as there's data, I cannot confidently tell you. But yes, as per our tradition, as per Ayurveda that we know, turmeric has healing ability. What kind of diet? Yes, avoid high fatty foods. They are not good for us, meaning excessive oil, just fat. No, they will lead to colon and prostate cancer. It's not good. Eat a lot of green leafy vegetables or high fiber diet. What it will do is take away a lot of the cancer causing stuff that may be there in your diet and bring it out through your stools or motions. So that way, that's very, very important. At the end of it all boils down to having a very healthy, balanced diet and not doing anything in excess. In Japan, they use miso soup. They drink miso soup 3 times a day, and it is documented to reduce the risk of colorectal cancer. Along with reducing the risk of heart disease, it reduces the risk of colorectal cancer. So there is a lot of ability in our routine food to either harm us or protect us. And we must rely on age-old knowledge and wisdom to be able to choose which is right. But the safest thing to do is do everything in moderation and keep your diet balanced. Don't do anything in excess. Like, don't starve yourself nor overeat. Both are equally dangerous.
Right. Okay, so here is a specific question from a cancer survivor. Jiru says, I had undergone breast cancer. She's cured, but was kept on Femara tablets to be continued for about 5 years. She says, now my bones are aching. She has lower back pain and on her wrist, and she's got osteoporosis now. What can she do to make her bones strong? Because she really feels weakness and her energy levels are low.
Well, that's a very good question. The first thing, of course, if she was at NURA, I would have done a bone density scan for her and checked if her bones are really weak. But otherwise, she's not here. Then she can do a vitamin D and a calcium check, or what we call as a bone mineral density panel, and look at it. Now, if there are reversible things that can be done, like if the vitamin D is on the lower side or the calcium is on the lower side, she can then correct that. It's easily done. Tablets is all that it needs, and she might start getting better. Also, activity. And I mean safe physical activity. I'm not saying tomorrow get up and start running. No, I'm saying as much as possible, indulge in activity that is tolerable. I mean, that the person is able to tolerate. So they shouldn't fall, because fall will cause a fracture. So they should just have activity. What that will do is it will strengthen the bones rather than inactivity, which will worsen it. Which will again lead to muscle wasting, and the bones will become further weaker. When they have activity, it becomes stronger. That is the second thing. The third thing is to find out why she is undergoing the osteoporosis. Is it generally age related, or is it hormonal that is causing the osteoporosis? That her doctor who is treating her will be the best person to answer. And they will tell, is it a side effect, whatever you're having, or is it because of age, or is it you're having some hormonal imbalance which is causing it? That the doctor will be able to tell and advise accordingly as to what would be the best treatment for that, if that is the case.
Okay, all right. Rajan has another question. She says, she's asking, is there a blood test that can help determine if one has cancer cells?
Certain cancers have blood tests, not everything. Certain, like I said, the prostate cancer, we do a blood test. It's prostate specific antigen. We also have tests like CA19, we have CA125, that's for colon cancer, ovarian cancer, that we can do. So certain cancers we can do blood tests, but like we can't do for lung cancer, we can't do for brain cancer, we can't do for breast cancer. They don't have blood tests. Yes, so it depends on the type of cancer. Some of them we're able to find these tumor markers. We call them tumor markers. Some of them don't have. So it is always a combination, imaging and blood test and all of that. So together we'll be able to screen for it, not just by a test. Okay.
So Morita-san has also asked us a question. He wants to know that if detected early, is the treatment cost cheaper in India than when it's a later stage detection?
Absolutely. That definitely, not just in India, anywhere in the world, if cancer is detected early, the treatment cost is exponentially less. We always say exponentially more, it's exponentially less. It's like if detected late, cancer treatment can cost you anywhere between initially itself 2 to 5 lakhs, and then going up as much as you need follow-up and so on. If detected early, that number is going to come down to what, 5,000, 10,000 at the maximum? Yeah, maybe if there's just a minor surgery needed, up to 50,000. That's all. So that's like a huge, come down on the price. So you are reducing the price from anywhere to 1/10 to 1/50th Sometimes it can cause, there are people who have taken injections worth crores of rupees as well, right? So it's unlimited, depending on what is the drug that you're trying to source and get and what is the treatment that they want. And you're looking at it as over the next 3 to 5 years expense. Whereas if detected early, you're looking at it only for the next 3 to 6 months, maybe, that's all.
Okay. Usha is asking that if after 5 years one is screened and is told that you're cancer free, is one really out of cancer?
Yes, at that point of time, yes. We're not doing genetic testing. See, there is a difference. We can do genetic testing. It will only tell that person, is there a risk of cancer? It will not tell them if they have cancer, right? To be able to tell somebody that they have cancer, they have to do all these tests that I was talking about, do the scans and everything, yes? And if that's not showing anything, they can be reasonably safe. Okay, I don't have cancer, but they have to screen themselves again on a routine basis. So like I said, once a year after the age of 40, or if it is after the age of 30, once in 2 years. So they have to screen themselves regularly. Is that right? So yes, at that point they don't have cancer, but it's like going to school, right? In school, you go, you write your exam for 8th standard and you pass. Then again, you write an exam in 9th standard and you pass. So it's not like you passed in 8th standard and then they directly take you and finish school. So that's how health also is. Every year you see if your report card is coming good because of how much you invested in it in the previous year. So that's how we must approach health. I study hard and I pass, and that's what we do.
Usha, was this your question? Or were you talking about a relapse or a remission kind of a thing? Was that your question? You can unmute, yeah.
Yes, doctor, this was my question because I'm a cancer survivor. I had endometrium cancer and now I'm out of it. And then I have been screened and I've tested out of it. Now it's just about a couple of years. So
yeah. So now I understand your question, madam. So yes, definitely you are out of it. So you can be safe and assured that you're out of cancer, but your doctor will tell you to screen at regular intervals and you must follow that. Mm-hmm. That's for us to be sure that you're always on the safer side. After about 5 to 6 years, then you can start feeling a little more relaxed and say, okay, I'm good.
Doctor, we don't have any more questions, but there's one last question which somebody wanted to know, the cost of scanning. So if you could just quickly touch upon that, the packages and the cost of scanning.
Oh, here. Yeah. All right. So at NURA, the whole package costs you about 15,000. For men, in this, you will have 4 CT scans where we do 2 for lung, 1 is for cancer, and 1 is for any pollution-related change or COPD. We also look at the heart and the blood vessels that's there. There is a block in that. We also do a visceral fat. So these are the 4 scans that we do for you. Plus, we also look at your bone mineral density and also your fat and muscle distribution. Plus, we do blood tests for you to look for liver, kidney, your cholesterol, glucose control, any infections or anemia, and also prostate cancer, and oral screening also is done. All of this is 15,000. For women, along with this, we also do a mammogram and we also do a colposcopy when we do cervical screening, and that is also 15,000. I'm not trying to sell it, but I'm just telling you that if we do all of these scans outside, there are 2 problems. One, it will cost you easily 35,000 or more maybe, but also the risk of radiation. Yes. So with the CT scans outside, this is latest technology from Fujifilm. Luckily, they use artificial intelligence. So the radiation, like I said, is equal to 1 or 2 X-rays, but outside CT scans don't have that ability. There, the CT scan, each CT scan is about equal to 80 to 100 X-rays. So radiation and also cost will be higher. But here it's about 15,000 that we do all of this together for. And all of these are some things that you can change in your life. We don't do tests that are not applicable in changing whatever you're doing. So everything that we do is tailored at, okay, this is what we're telling you, you can change this. This is what we're telling you, you can change this. It's not like do 10 tests out of which 5 are useless and I don't even look at it. So we don't do that kind of an approach. So that's what we do.
And I think the other additional benefit is the total time that you take, right? It's 120 minutes, the entire process for finishing all the tests and your consultation with the doctor as well.
Yeah, so you get the reports immediately. The doctor's also waiting to see you 2 hours. You're out of it and you are done for your screening for the year. Okay, so for your year, spend 2 hours for your health, and you have a more comprehensive screening, meet the doctor, and then continue, live a happy life.
We have come to the end of the session today. So thank you so much. I think it was very educational and very enlightening and informative. Given the questions we had, I feel that when you have come to the end of the questions, it means your job's well done because you've been able to address it all and there are no more questions left to be answered. So thank you so much. Thank you everyone for joining us. And it has been a great pleasure again, Dr. Tausif.